Hi everyone, I'm Dr. RakheeYadav, consultant pediatrician. Welcome to my live session today. The topic is Covid-19 Vaccination Centre from a GP's perspective. And I have with me my guest speaker, Dr. Imelda Idzham. She is a GP in one of the clinics, one of the Idzham clinics. There are 10 clinics if I'm not mistaken, and she's a GP in one of those clinics. So she'll be telling us about how her experience is in the past 2 weeks being a GP handling the COVID vaccination program from a GP's perspective. So let me just add her in. Just give me a minute. Hi, Dr. Imelda. I've just sent you an invite. Just click. Hi.
Hello, how are you?
Hi, Imelda. Oh my God, sorry. Rambut I pun's rabut. Sorry. How are you?
I'm fine, thank you.
Thank you so much for doing the live session with me.
Okay.
I know how busy your clinic has been lately, especially with the vaccine drive-through that you've started. And congratulations. Yeah, such a good part from the clinic Idzham. I think, do you want to just tell us a little bit about yourself? Because I know you have 10 clinics, Idzham clinics.
Yes,
but
okay.
do start.
So,
Yeah.
okay. Hello, everyone. I'm Imelda. I've been a doctor for 20 years now, or 19, since 2002. So I graduated from Sheffield in 2002. Oh my God, that's telling of our age. And I did FRCGP. I finished my FRCGP in 2015. So now I work for Klinik Idzham, which was actually my dad's clinic, and we have 10 clinics around the Klang Valley. We started in Malawati. We have a few in Malawati, a lot in Ulu Kelang, and this is Kota Damansara, our youngest branch, which is about 10 years. About 10 years, yes. So I've been a GP since 2019. So that's what, 12 years now. Oh my gosh.
Wow.
Yes, that's how long.
2009, you mean, not 2019.
2009. I beg your pardon. Yes, 2009. Yes,
I've been
a GP since 2009. Yes, yes.
I'm like, Imelda has been a GP much longer than 2 years. So yes.
Yes, yes.
So tell me, Imelda, what are the type of cases that GPs have been normally seeing during the pandemic?
Okay, so our demographic cases actually changed during the pandemic. We used to see a lot of cough and colds, a lot of, especially children actually. So with the pandemic, the children have been at home. I'm sure you know this also. Yeah. So we used to see a lot of acute gastro, diarrhea and vomiting, a lot of hand mouth disease, a lot of that.
Okay.
And a lot of yes, cough and colds. That was usually our bread and butter. But during the pandemic, all this sort of ceased because people don't see each other basically. So they don't. There's no more hugging, no more nothing. So all this kind of ceased. So we started seeing other things, and now the demographic has changed to more of like anxiety. People are worried. UTIs actually, lots of UTIs. Oh. I don't know why. I don't know. No more. Yeah. We do still have lots of cough and colds because a lot of people, the COVID come walking in, and they do, and we still see it, but and then we advise accordingly, like to go and get the RTKs or PCRs or whatever.
Does your clinic do those tests, the RTKs as well as the PCR?
Not in Kota Damansara. Actually, only one of our branches does it. It's in Gombak, Medan Idaman, because it fits with the SOP. Because it's a tedious thing. You need to like in and out thing. So most of our clinics are small, cute, so they don't really
fit the criteria.
Yeah, they don't follow the SOP and criteria, so it's best not to do it. Yeah, it's best to be safe.
Okay, so what made you decide to volunteer for the GP vaccine center when the government? I think they initially made it they made it known that they want the GPs to help out. I think somewhere in April, May, around there, and then they started opening up. So what made you all decide to join?
Well, that's the way forward out of this mess. It's the way forward. We need to get herd immunity, and everybody, all doctors on board should sort of like sign up. I think that's what we should do as national service. I think we need to get this herd immunity up and running. Oh my God.
Yes, we do, my dear. Oh
Yes,
gosh.
so it was very important to help get this vaccination ongoing. I think the rollout has been a bit
Slow.
Yes, that's the word for it. Yes.
All right, do you want to tell us the process? Because I attended the training module because my hospital is one of those that will be volunteering for the vaccine center. But hospital and GPs, you have to go through a certain training module. So I went through that and it was so tedious.
It is.
Do you want to tell us the process that you went through?
We started in April. In April, we started, Protect Health invited a lot of clinics to join them to do this wonderful, wonderful initiative. And we had to fill in a lot of things like your, like your clinic and your who's in charge and all these things. And then you had to make sure that you had certain requirements because certain vaccines needed very strict and stringent cold
temperature
chain
control.
Temperature control. Yes.
Yeah.
So obviously they wanted us to have the correct fridge, so you need thermal data loggers, and so on and so forth lah. So a lot of clinics, so we had to, because some of our clinics are old and were not updated, so we didn't have a lot of fridge. We need to get the fridge. So the fridge that you need, actually, you cannot have the freezer part. So you cannot have things like, in the hotel rooms, you have these hotel mini bars. You can't have those fridges.
Yeah.
You can't have this fridge.
Yeah.
But all the updated new clinics should, if you're going to open a clinic, you should know that you cannot have these things because it is temperature sensitive and it can change your temperature. So your cold chain needs to be 229, and so we needed this freezer we need this fridge without the freezer part. So a lot of updating. So it was a bit tedious, and for some of the new clinics all have thermometer loggers. So they have this like USB, you know what I mean, right? The USB, but a lot
of digital thermometers.
The old clinics don't have them. So some of the old, so we have to buy all these things. So a lot of clinics, like, you have to invest first before, and they don't really pay us much. They only gave us 14 ringgit per patient. So, but this is not about money. It's about helping the country.
Absolutely.
Yeah. So it's not.
No, but I was just trying to tell. I mean, for me, it's more of creating the awareness that if someone goes to a GP, that there's so much that has gone on behind the scenes. Not just a matter of the government giving you the vaccine and then you're just going to be the tukang cucuk lah, the vaccinator. But there's a lot of process behind it. So you had paperwork, you had to buy your equipment, and even the cooler box had to be WHO pre-qualified kind of cooler box.
Yes.
And then you have got all the paperwork.
Yes, we had
the computer system that you had to learn.
Yes, we had to learn the Myva system. We had to download some clinics had to buy new tablets, new upgrade systems. So it was a lot of work, a lot of processes before we opened this. Even mine, because mine's a little really cute tiny PPV, but a lot of processing. You need to make sure that your staff was trained. You need the training part. So we had to join, and it was hard because it was online training.
Yeah.
So we had to do 3 or 4 hours of
for 4 or 5 hours or something.
Yes, of online training. I think we did it 3
non-stop
times.
training.
Yes, it was really tedious, tedious, and a lot.
Tedious, so there's a lot of background work that goes on behind a GP setup, or even a hospital setup, or an ambulatory ACC, ambulatory care center. So all the non-government setups, there's a lot of paperwork, and there's a lot of precursors. There's a lot of equipment that has to be, put into place before you can open.
Yes, and a logistic, because we had to go and pick the vaccine up
at
various klinik kesihatan. So we need to make sure we have enough manpower to go and pick up these various, because we have 10 clinics, so we had to go to 10 different places on Tuesday.
Wow.
So it was a bit.
Is it a daily pickup or a weekly?
No,
or how
do
they let you pick up?
Weekly. Hello, we're back.
Hi. What happened? Yeah.
I was going to write you a little note.
No. Okay. All right. So you were saying
It's my
you pick up the
internet. I don't know
vaccines
what
in a
happened.